Greetings. Greetings and welcome. I'm John Fanestil, Executive Director at VIA International. Welcome to VIA Voices. This is the first of our weekly series of interviews with people from along and across the border. I wanted to just share a brief word about the VIA Voices series, which begins today. We'll be gathering every Tuesday at 12 noon here on the Zoom meeting format. And we'll be chatting with people from along and across the border with different focuses and different interests, but all sharing a concern for the long-standing passions of VIA International, which is our host organization. The VIA Cafe is live online. VIA Cafe is an online platform intended to introduce people to the culture and community of VIA International. Many of you I know have already visited, and I'll make a pitch a little later today to encourage you to visit again. But VIA International, our mission is to promote sustainable community development while connecting people across borders. And so this VIA Cafe online platform is an opportunity and an invitation for people to do just that, to promote work being done, especially in Tijuana, but also in other parts, as well as to connect across borders through this virtual space. I'm waiting on our guest today. Here he is. I'm going to admit him right away, and I'll say hello to him and introduce him to you, and then we'll get going.
Hello, everybody. I don't know if you can hear me and see me, John.
Yes, greetings, Dr. Smith. Thank you for joining us. So nice to see you. Can you hear me?
Yes, I do. Thank you very much. Thank you for the invitation. I apologize. I was just finishing another meeting and then I realized the timing. So sorry about that.
No, we're so glad you're here, and we appreciate you're taking the time out of your busy day. In fact, I had just shared with people a little bit about this VIA Voices series, of which this is our maiden voyage, our first Tuesday noon interview, and we are especially appreciative that you took time to be with us. Dr. Andre Smith was referred to me by a friend, a mutual friend, Dr. Genaro Fernandez. Dr. Fernandez is a longtime friend of mine and a cardiologist at Sharp Chula Vista Hospital. And when I queried Genaro Fernandez about our interest in the changing dynamics of public health in the face of the coronavirus along and across the San Diego-Tijuana border, Genaro immediately said, "There's nobody better than you could speak to than my friend, Dr. Andre Smith." So thank you again, Dr. Smith, for joining us.
Thank you.
Dr. Smith is Director of Emergency Medicine at Sharp Chula Vista and is also the President of the Board at the Cruz Roja in Tijuana. And so, Dr. Smith, what I'd like to do, if you're willing, is I'm going to put a little bit of a spotlight on you. I'll bring you to the front of the line, if you will, and then I'll just ask you a few questions to get the conversation started. For the rest of you, I would encourage you to think of questions you'd like to ask. I'm just going to chat with Dr. Smith for about 20 minutes or so, and at that time, I'll open it up. And if you'd like to ask some questions yourself, I'm going to encourage you to jot those questions down in the chat function. If you've not been in Zoom before, at the bottom of your screen, you'll find a little chat icon. You can open that up. And if you would jot down questions that come to you along the way, we'll surface those questions a little later in the program. We're going to be finished just at 12:50 today. We don't want to take more of your lunch hour than that. But if you, along the way, have questions you want to ask, if you jot them down into the chat function, we'll get to those as best we can toward the end of the program. So let me bring Dr. Smith to center stage, as it were. And thank you again for joining us.
Thank you.
Very good. I thought I might just first.
I missed the last part.
I see. Let me just ask you a couple of questions to get started.
Sure.
How has your life changed at Sharp Emergency Medicine in the last 3 months?
Oh, it's been an adventure. One of the things that I probably would tell you as an emergency physician, we're prepared for the worst. We're prepared to practice disaster medicine as well, and to be able to function with limited resources. And one of the things that I probably would tell you is definitely within my career, I've had many situations that put you in a very critical condition or situation, in terms of managing a patient. But to be involved in a pandemic, I probably could tell you that this is not something that I was going to imagine that it would happen in my lifetime. And hopefully that will be the last one. But and with that being said, is we we go through disaster preparedness several times during the year in the U.S. And I can tell you that it was not enough. I mean, you get the basics, but once it's real, especially something that you cannot see, a virus is something that it's around the air. It's around, basically it's being transmitted from person to person. And that I can tell you that probably was something that I never imagined that it was going to happen. And with that being said, being at the border, I think it puts you in a different or a very unique situation because the a virus or an illness does not understand borders. So being very close to San Diego with our sister city of Tijuana, we think that, whatever happens in Tijuana is not going to happen over here or the opposite. And one of the things that we saw as time went by is that definitely there's an effect from one place to the other. And I can tell you that that has been my experience. We tried to prepare. We did, we started seeing what was happening in another country, then another country, then in America, then it started happening in different parts of the country, with in the U.S., whether it was Seattle, whether it was San Francisco, whether it was New York, and we in the state of California, we started to kind of say, okay, well, we need to do these, these perspectives. We need to analyze the situation. We started thinking about starting a disaster tent. We did it. We started planning of, okay, what are the areas for isolation for the people that are coming in based on the experience that they're seeing in other countries, or in this case, like in New York. And when we started doing this, I think the anxiety started to rise because we were thinking about it. Is that enough? Do we need to do more? The protective equipment that we have, is that something that is going to help us? Or am I going to be a victim of infection as well? We were seeing that in other countries that healthcare workers, doctors, nurses, whoever was working in the hospital was also getting infected. And we felt that the anxiety level rose very dramatically within a few weeks of trying to organize this situation.
Yeah. And what do you hear from your colleagues at the Cruz Roja in Tijuana? Have they experienced a similar dynamic, or what is it about their experience that seems different from yours in Chula Vista?
Well, for me, as I'm being the director of the ER and learning what was occurring here in San Diego when we started getting cases. Interestingly enough, probably we started with more cases here in San Diego, and then slowly it started to evolve in Tijuana. So what I kind of brought the experience of what we were doing over here, and then I brought it to the Cruz Roja and Tijuana as the president of the board. I started to basically implement ideas and tailor them to the needs, and basically what not only the needs but also the the equipment that we had, the limited equipment that we had. So we started to prepare for that. In this case, in Cruz Roja, creating the same situation where we started to prepare isolation sections in the ER, in the hospital, try to get ventilators in advance, try to have the N95s, if you heard, the protective gear, the gowns, the mask, all the things that we needed for this. And we saw the same situation first. And I can tell you, probably it happened in San Diego too. At the beginning, is like, oh, is this something real? Even within healthcare, the healthcare staff. And I saw the same situation in Tijuana, or in this case with the Tijuana Red Cross. Then as cases started to come in, then the anxiety level went up again. So basically mirror image is just with a later phase of what we went through here in San Diego. And so, with that being said, is I tried to prepare for the worst in both cases. We were very close to not having enough protection, not having enough surgical masks or N95s. Luckily, we've been able to manage. But what we've done, we normally when we start having these scenarios, we count, but the number of days that we have of protective equipment, and we were reaching at a point in basically both cities, at least in both hospitals where I participate at, which is Cruz Roja and Sharp, where we were pretty much almost to a point where we only had like about a week or two of protective equipment. And that was very scary. Luckily, again, we started getting, we were able to get more. We started to get a big mobilization of the community to help. And that actually was hugely important because in both cities, but especially in Tijuana, we saw that there were more people that were helping out to get this material that was needed.
Yeah. And I am assuming that, oops, we may have just lost, can you still hear me, Dr. Smith?
Yes, I can.
Okay, there you are. There you are. We lost your photo camera just briefly, but glad to have you back. I'm guessing that the strategies for containing the spread of the virus, both within the institutional settings, but also within the larger public, are broadly similar between San Diego and Tijuana. But I'm sure there must be some wrinkles and differences of ways of going about this preventing the transmission. Do you see any real differences between how the medical professionals, public health professionals are tackling this in Tijuana as compared to the way we're tackling it here in San Diego?
Well, the difference is the technology and the and the resources. I mean, definitely that is a big difference in terms of the preparedness of the physicians and nurses and the willingness, the patriotism of as a healthcare worker to take care of their fellow person. I see that in all. Basically, this is something universal, and I've seen that with participating to visit Cruz Roja, but also the Tijuana General Hospital, which is a COVID facility. Definitely, those are the things that I've seen. There's a lot of passion basically behind it to help basically folks. I just finished the meeting with actually it's still going on. I had to kind of disconnect, but this was an important meeting. But basically, it's with leadership uh, uh, people from San Diego in the healthcare industry that had a meeting with the minister, Secretary of Health for Baja, to give an update of what's the situation that is going on right now. And the other question was, well, what can we do to help? And within that, there were several things that the Secretary of Health asked from Baja. One is they need staff. One of the realities that happened is that when this started, this was a federal mandate that any person who was 60 years or older that was either a physician or a nurse, that they did not, basically they were asked not to come in and work. Also, if they had any comorbidity like diabetes, hypertension, obesity, also for them they were asked not to come to work. And the the Secretary of Health mentioned that basically when that occurred, he lost about 30% of the healthcare workers. That's a big percentage. And that created a effect because basically they lost physicians and nurses all of a sudden. And so one of the things that he brought up is, at this moment is we still need volunteers, we need physicians, we need nurses. they still need PPEs, what we call PPEs, which is personal protective equipment. Those are the greatest need that they have right now. Also, what's very interesting is that when uh, when this, basically what's been going on between San Diego and Tijuana, in general, things have gone a little better overall. What's very interesting between San Diego is that the northern part of San Diego definitely is a lot, the cases are definitely smaller. In the southern part of San Diego, we still have a higher percentage. It's getting a little better, but still is higher than the, again, northern part of San Diego. And one of the things that what I can tell you is, and is that, is it, what is it? What's the reason behind it? And I would say that probably it's because there is a percentage, there's about a quarter of a million people that are American retirees, or these are people that have a permanent, basically that these are people that work in San Diego, but they live in Tijuana and they cross a border every day.
Yes.
That I think has an effect. That's the second part is we also have in the southern part of San Diego, we also have a community that has a lot of family on the Mexican side. So there's been this migration of going back and forth, and we assume that that could be the reason. There it's a theory, but I mean that's the only thing that probably could be able to say is about that. That could be the reason.
Yeah.
It's been asked to me in the past, well, is it Mexican people that are crossing for healthcare in San Diego? And I can tell you the majority of the people that are coming to Sharp Chula Vista Hospital, these are people that do have a connection with San Diego. They do have established address. And we have not seen at the moment, we have not seen Mexican people crossing for healthcare, because this is something that has been brought up in the past. And I just wanted to kind of clear that up. And again, this is on numbers that we have at Sharp Chula Vista.
Thank you for that. Yeah, I know.
But overall, yeah, go ahead.
About 5 years ago, I heard the U.S. Ambassador to Tijuana say that there were 350,000 U.S. citizens in Baja California Norte, and about 250,000 of those were retirees or snowbirds and so forth, and about 100,000 were U.S. citizens of Mexican ancestry, who of course have family relations and these kinds of binational extended families, as you are mentioning. So yes, in so many ways, of course, we can draw a hard line on the map.
Correct.
But the population is very much a binational population. Are there you mentioned the distinction between North County and South County San Diego. Are your colleagues at the Cruz Roja in Tijuana, are they seeing differences in terms of the spread among different parts of the population within Tijuana? Are there particular populations that are proving especially vulnerable to the virus, as we are learning here, of course, in the United States?
Yes, and I mean it's basically we did is we took a small sample of basically people that called for 911, and we looked at the data of whenever and how many people, what's the highest location of people asking for 911. Also, who is having the greatest death upon arrival of an ambulance or before the ambulance arrives. And what we saw is that actually the highest number are within the eastern part of Tijuana, which is close to Tecate, but also that's an area of a lower socioeconomic status, and definitely we've seen that there's been a higher mortality in those regions. Also, what we saw is that the highest amount of people that have some kind of respiratory illness actually were calling more of the overall community throughout. But in general, yes, we did see that the mortality was higher in the poverty areas of the city of Tijuana. One thing that I wanted to say that I think is very important, because it was brought up about, okay, what can we do to help right now? to Tijuana, especially because the crisis that they have that are going through. And I can tell you that our San Diego physicians are participating in the help. It started last week where specialists in intensive care medicine or critical care medicine are going to Tijuana every day to, in a volunteer basis, that are going to actually basically as a consultation, they're coming to help the Mexican doctors, especially at the Tijuana General Hospital. So
Mm.
I've seen that tremendous collaboration between physicians to help. And so right now, basically, there's one critical care doctor going every day with a critical care nurse, where they see, they basically manage about 20 patients, again, with collaboration with the Mexican doctors and nurses. And the idea is to help to improve the mortality that they're having, especially with the patients that are in a ventilator.
Yeah. Thank you. Well, that may be an answer to the question I was going to ask, but I'll ask it anyway in case there's another. Is there one, if there were one small change, not that would solve the whole problem, but one small change that would make your life easier, either in your role at Sharp Chula Vista or in your role with the Cruz Roja in Tijuana? Is there one small change that would really make your work easier? Is there anything that comes to mind?
Well, I mean, I think from the socialistic aspect or the social aspect is that we need to, we hear in the news, businesses are opening, different sections of the city are opening slowly. And I think what I would say is please follow the rules or the recommendations. It's the virus is still there. You might hear sometimes that maybe the numbers are decreasing, but that doesn't mean it is completely eradicated in the community. We still see cases. And I think it's one thing that I would say is, and I don't want to scare folks, about 90% of the people, they get infected, they have minor symptoms, and they get better. Many of them, they don't even go to the doctor, they don't even go to the hospital. That's 90%. But about 10%, they do need to seek medical care, or they do seek medical care. Out of that number, there's a small percentage that end up admitting in the hospital because they get ill. And this is a virus that unfortunately it just not doesn't affect the lungs. It affects different parts of your body. And some people get sick within 24 hours, like very, very sick. So, and I can tell you, for example, that these are international statistics. When a person gets admitted to the hospital, about of 100%, a third end up in the intensive care unit.
Mm.
That's a lot. 33% of the people that are get admitted with COVID-19 go to ICU. The once a person especially is intubated, the mortality is about almost 25%. That's very high. So this is an illness that we have to take it very seriously. So my recommendation would be right now is to make sure that don't drop your defense right now. I think everybody has done very good in San Diego, and they've been following, wearing a mask, doing social distancing, washing their hands constantly. I think it's hugely important. But I think, again, as we as society are trying to open our economy, which it's totally understandable, you just have to do it with due diligence. So that's what I would ask from everybody in the community, to make sure that that continues.
Thank you very much. Thank you. Well, I'm going to stop right there for just a moment to see if we have questions from our group. We have about 38 participants today, a wonderful turnout. And again, we so appreciate your being with us, Dr. Smith. If you can stay with us just another 20 minutes or so, we'll see some questions that people have from our group of participants. As you may be aware, or perhaps if you're not familiar, Dr. Smith, Via International has a long history working in Tijuana through its sister organization, Los Niños de Baja California, doing sustainable community development. So many people on the call are longtime workers, colleagues, if you will, binational, fronterizo, people working in community development and sustainable development on both sides of the border. So we have many wonderful friends. I do want to just say a quick word to them before I open it up for questions. And this is a bit of a reminder for those of you who have not yet visited our VIA Cafe. Let me just share my screen with you briefly so that I can encourage you to check out the VIA Cafe. This is our new online platform for connecting with friends and supporters of VIA International, and also for new people who might want to connect across borders and create some solidarity across the border. This is the VIA Voices series, of which this is our first presentation. And I just want to lift up, there is an opportunity to sponsor this program at the $10, $25, or $50 level. But there's also programs of language learning. If you'd like to take a Spanish class or practice your Spanish with a conversation partner, we're calling them charla amigos. And then there's also opportunities to support small businesses in Tijuana who are themselves sustaining their businesses by delivering much needed meals and cleaning supplies to some of the shelters in Tijuana. And then we also, through our Rosarito-based coffee partner, are distributing coffee from microcredit enterprises in Mexico and Guatemala. So I just want to encourage you, if you've not yet done it, to visit viacafe.org and to contribute if you can to support this effort. And we thank you very much. And please don't hesitate to reach out to me. We have many other staff members here from VIA International. Any of us would be glad to tell you more about the VIA Cafe, as well as the ongoing work of VIA International. So with that, let me go ahead now and ask Joanna Salazar-Harris, Staff Development Director here at VIA International. Joanna, have you been seeing some questions come in? And is there a question you'd like to lift up for Dr. Smith?
I have. There are a lot of questions. And as you described our work on both sides of the border, as you can guess, there are quite a few questions about the reality of COVID in Tijuana. So one of those that rose to the top, it regards the socioeconomic indicators of the pandemic in Tijuana. And you did briefly mention that the mortality rate is higher in the more low income areas of the city. But specifically, someone wanted to know what percentage of people infected are living at or under the poverty line, if you have figures on that.
Unfortunately, I don't have a percentage, but I would like to add, make a couple of comments of what's happening right now. And this was part of the meeting with our Secretary of Health. In Tijuana, the curve is coming down, as in San Diego. But we are expecting another rise. Okay, we just don't know how big it's going to be, but it is expected. And part of it is, as we open again our businesses, there is the concern, which we've seen in other countries and in other cities as well, that as you open the community, there are people that forget to follow these recommendations of what's been, again, the rules. So, and then there's a rise again of infection. And that is a reality. We are very likely we're going to see it in San Diego. Very likely we're going to see it in Tijuana. There is something else that is happening right now. Mexicali, right now, they're behind in terms of the acuity. In other words, we started first. Now Mexicali is getting hit pretty dramatically right now. Their numbers of cases are astronomical. And we've seen that also, that there's been an effect on El Centro, California, where they're basically Imperial County right now. And one of the things that has happened is, here in San Diego, for example, we have many hospitals. We have an infrastructure that, if the numbers rise, we're able to kind of distribute the patients within all these hospitals. In Imperial County, especially in El Centro, there's only 2 hospitals, and they're small. So what we have seen is they got overwhelmed. They were not able to manage the magnitude of this. And therefore, what has happened is the state, as well as a federal level, they had to intervene and help actually El Centro, California. So that's happening right now. Many of these patients are being moved to other hospitals in San Diego, all the way up to even Temecula. So to be able to move these patients out of that area, just because, again, they don't have the infrastructure like we do here in San Diego. So those definitely, that's something that we've been seeing. And So I mean, again, it's not, it doesn't answer the question, but I just wanted to add that information, which is something that it is real and it's happening at the moment.
Thank you. Thank you. Joanna, what other questions have?
Well, in regards to that, about hospitals being overwhelmed, there is a question about the reality of Tijuana hospitals to handle the amount of COVID patients. And are you seeing that the hospitals in Tijuana are capable of handling the load that they're getting, or are they overwhelmed?
Interesting, very good question. And hopefully I'm going to answer it as best as I can. If you, before I went to the US, many countries who have a medical infrastructure, they were not able to manage. In the US, where we have one of the biggest investments in healthcare in the world, we were not able to manage 100%. New York, it went to Seattle, it went to San Francisco, now LA. There were cities that became overwhelmed, that they were not able to manage the situation. Tijuana, less infrastructure, bigger impact. And one of the things, for example, that I would say is, and what happens in one city or one country, we see that in another place. In New York, there were hospitals that basically they ran out of critical care doctors because they had so many people with ventilators. So doctors who did not have experience had to intervene to help out, whether it was emergency medicine doctors, whether there were cardiologists. Again, that was not their expertise, but they were probably the closest to a critical care doctor, and they were managing these very sick patients. In the general wards, for example, in New York, there were hospitals that they had to ask psychiatrists, rheumatologists, dermatologists to help out to manage the lower acuity COVID patients. That was in New York. Now, in Tijuana, it's the same situation. There's one floor with 20 patients with ventilators, where we've been helping to manage that floor with the San Diego doctors. The team that they had over there, they were a pediatric cardiologist managing adults, a pediatric anesthesiologist managing adults, because that's the only doctors they had. And they're very good, passionate doctors. But basically, once you start running out of resources, whether it's manpower, then you look for what you have or what you can get. And that was the situation. So no, not enough resources, but they're trying to do their best with what they have.
Thank you for that. Other questions?
Yes, in regards to Sharp hospitals here in San Diego, there are a few questions. First, there's a question about demographic information that's gathered upon intake for COVID patients. What does Sharp gather? Does Sharp coordinate this reporting of data? And related is how are undocumented workers being handled and treated and received at local hospitals?
Well, it's a very good question. And first of all, when a person comes to the hospital, we do not ask for legal status or immigration status. We treat everybody in a universal way. We basically just ask for general information, phone number, where do you live, next of kin, any family member in terms of information that we could be able to put that on in terms of the demographics. But everybody's treated the same, and we manage basically the community that comes in. So if the person is having an emergency, we treat them as a person. Things that they have an emergency, but once we screen them and we see that the patient's stable, we basically continue the management until we see that the person is stable enough that they could be able to follow up at a local community clinic. So that's one thing that we've been doing. And Sharp, and I can tell you not only just Sharp, but all the hospitals in the county of San Diego follow the same system. So there is no difference in terms of medical care, whether you have a legal status or a illegal status in terms of the people that are coming into the hospital. One thing that I would say that I think is very important in San Diego, we when with this pandemic, uh, we ask people, hey, if you don't have an emergency, consider maybe using other resources, like maybe going, calling your primary doctor, go to the local clinic or call the local clinic and see if they could be able to manage you. Unfortunately, one of the things that we saw is that people that were having chest pain, they were not calling 911 because they were scared. They didn't want to go to the hospital because basically the hospitals were preparing for the coronavirus or for the COVID. And we saw that many people, unfortunately, did develop a heart attack or they got a stroke. Or if they were diabetic, they got so sick with infections or the diabetes got out of control to the point that people were going into coma because of their diabetes. Mm-hmm. So what I would say is, and now that we've gone through this situation, all the ERs, we have a section for the people that we suspect that they could be having COVID, but then we have another totally different section for the people that once we evaluate, when they come to triage, and we see that they don't have any COVID symptoms, we put them in a different section of the ER. And the reason is because we want the community to have the confidence from in all the ERs that it's safe to go to the hospital, it's safe to go to the ER, it's safe to go for medical care. So that would be one of the messages that I would say to our community and the listeners right now. If you're not feeling well, you can go to the hospital. We're going to make sure that we protect you. We're going to make sure that we take care of you. And I think it's very, very important right now.
Thank you. I'll throw in one quick question, then Joanna, perhaps you'll have another one. But Dr. Smith, we're looking back here in the United States. 100 years ago was the 1918 flu pandemic, and I'm just curious if you were to imagine 100 years from now, and we're thinking optimistically, what would you hope that people might say 100 years from now, looking back on the coronavirus pandemic, especially here in the border region? If there was a lesson learned or looking back on it, something that people would take for good from it, is there anything you would imagine 100 years from now they might be saying, back then along the border in response to the pandemic, something happened?
Oh God, that's a very good question. Very philosophical too. As a physician, I think one of the things that I would say is there's two things. One is I think we could do better on creating vaccines. Definitely, I think that's an area that I think we need to work on. Second, what we learned, if the community actually is going to suffer less. In other words, which from the beginning, basically, it was mentioned that it was like social distancing, washing your hands, covering your face, using a mask. That actually really helped. We could have been in a terrible situation in San Diego, and we were planning for the worst. I mean, our hospital has holes because we were putting tubes or air conditioning tubes, negative pressure rooms, to protect the healthcare staff from inhaling the virus. And we didn't care. I mean, there was a lot of money invested into it. Obviously, responsibly. But what I'm telling you is it did help. Whatever the community listened, they followed the rules, they stayed home. And I can tell you all of those things actually helped for us to not have a terrible infection especially in the city of San Diego.
Yeah, thank you very much. Thank you. Well, very good. Joanna, is there one other question that you'd want to lift up before we close?
There are a few more questions, but just related to what you were just saying, Dr. Smith, there's a question about compliance in San Diego versus Tijuana. What have you seen as far as the community at large and following the directives of wearing a mask and social distancing and whatnot?
Yeah, one difference is this. Tijuana is a third world country and development, but it's a third world country. The poverty level is higher. And it's kind of sad that basically about 40% of the community lives at a poverty level. And these are folks that live day to day. For example, here in the States, we were able to apply for unemployment and people got financial support to be able to kind of go through this. In other countries, that didn't happen. And people in that condition, they don't have a choice. They need to go out. If not, they're going to die of hunger. And these are people basically they in their mind is like either I die of COVID or I die of hunger. And people say, you know what? I'm sorry, I have kids that I have to feed, and people will go out. And I think that was one of the challenges that actually had to go through, because a lot of people were coming out because they have to find a way to be able to survive.
Yeah, that makes sense. I do have one last question. I think is an important one. So I want to
Please
mention. There was a question regarding the level of COVID being detected at the Otay Mesa Detention Center. That it actually is higher than in other detention centers across the U.S.-Mexico border. Do you have any insight into what's going on in the detention centers that you can share with us?
I'm afraid not. You know, that's an area that I have not been. I don't have any information.
Thank you. Well, very good. I know there are other questions queued up, but I do want to respect our time, and I do want to respect Dr. Smith's time. Also want to, again, encourage you, please visit the viacafe.org. Sponsor this series if you're able, contribute in some other way if you're able, sign up for Practice Your Spanish. We have friends on the call, in fact, who are part of our team in Tijuana. It's a Tijuana-based team of Charla Amigos. These are people who are making themselves available to speak Spanish. For those of you who might want to work on your Spanish or practice your Spanish or just have a conversation with somebody on the ground in Tijuana. So it's another way that we're offering support to our friends and colleagues in Tijuana who are turning themselves into Spanish teachers during this time of COVID. Doctor, yes, please.
I'm in the Spanish class and I love it.
Thank you for that testimonial, Rhonda. Yes, thank you. Dan Wattman, our language instructor, is teaching Spanish 101 right now as we speak. That's a 3-week course. And when that 3-week course is finished, I'll pick up and teach a 3-week course at the 201 level. But we've had thank you for that very much, Rhonda. We've been having great reviews from Dan's a close friend and longtime collaborator and has taught Spanish for a lot of years. So I know you'll have a lot of fun in that class. Please ping us if you have any questions about the Via Cafe, about the ongoing work of Via International. I do want to recognize on the call today, Elisa Sabatini, our President CEO, Rigo Reyes, our program director of program. You heard from Joanna Harris, our director of development. Also on the call, Aida Amador, our communications coordinator. So there's a whole team of us here that are glad to connect with you and reach out and make connections for you and with you if you'd like to learn more about work connecting people across borders and about the sustainable community development work we do in Tijuana. Dr. Smith, just to close, I want to say thank you very much. I hope you and we wish everything well for you and your family, for your colleagues there at Sharp, for your colleagues and partners at the Cruz Roja in Tijuana. We send our best wishes. We thank you for your work and thank you for taking the time for us today. And sometimes on these Zoom meetings, I encourage people to share a little round of applause. And so I'm just going to invite everybody, if you would, to just share a little round of applause, please, as we thank Dr. Smith for his time. And we bid you farewell, Dr. Smith, with our very, very best wishes. Thank you for joining us today.
Take care. Thank you. Bye-bye.
Okay, bye-bye. Very good. Well, thanks to all of you for joining here that first week of Via Voices. We'll be doing it again next week, same time, Tuesday, 12 noon. And Elisa, I wonder, would you want to say a word about the guest who will be joining us next week? Are you there, Elisa?
Yes, welcome to everyone. Next week, we will be joined by our coordinator from Mexico City. And she is having a very unique and different experience as part of kind of a COVID chronicle in what's going on in the city of 25 million in the circumstances that are happening there. So stay tuned and join in. Molly Cabrera, 4th, will be joining us from Mexico City next week.
Great, thank you. You can sign up for that at viacafe.org. Some people have asked, by the way, whether this will be the same link week by week. I'm not convinced that it will just yet. We're working on creating a Zoom meeting room that will be for the Via Cafe only. So at least for the time being, I'd ask your indulgence. And if you would go to that website and just, if you want to join next Tuesday, sign up for it through that free ticket, the free ticket for the next Tuesday event. That way you'll be sure to get the current link for next Tuesday's event. Eventually, we're going to standardize this, have a single link that would be for every Tuesday event. And those of you who want to join us weekly, you will be able to just hold on to that link in your, make a note of it and sign in each week. But for now, thanks for your patience with us as we get this series launched. And please do sign up for next Tuesday's session, along with anything else you'd like to do at the Via Cafe. So that's it for now. Thanks for joining us. We'll see you very soon. And have a great rest of the day and a wonderful week here in San Diego and Tijuana. Bye-bye.